Okay, large crowd. This is fantastic, and thank you for giving me the opportunity to speak with you today concerning functional foods. I think everyone in the audience is probably somewhat familiar with this topic. I like the term functional food. If you go into the internet, you'll hear things like pharma food or nutraceuticals. Again, I prefer functional food. I think the more we can stay away from trying to label things as a pharmaceutical from a food standpoint, the better it's going to be for us. And the reason being is you do not want to get into that regulatory category. So again, I think the term that we should be using is functional food. It's a very user-friendly term, and also, in my opinion, more explains what we're trying to do in this particular area. Now what I have here is a couple of pulls that I have from the internet, some cartoons and some slides. I'll just let you go ahead and read these. But people have, for a long period of time, centuries in fact, talked about the importance of food really as medicine, or using food to provide for your health and well-being. And I do like the one to the bottom left. We pay the doctor to make us better when we should really be paying the farmer to keep us healthy. And when you think about that, that makes a lot of sense. You know, when you go to the doctor, it's really not health care, it's sick care. That's exactly what it is, it's sick care. And right now we focus more on treatment than we do on prevention. And given where healthcare is going, it's absolutely necessary that we start coming up with ways, cost-effective ways, to deal with our healthcare situation. And one place where we're going to be able to do that is actually going to be with the foods that we're currently growing, some of the new foods that are currently developed at places like Abbott. So what is the definition of a functional food? Over here we have the USDA has a definition for functional foods. We have the Functional Food Center also defines it. Feel free to read. These are long definitions, but they really can be distilled down to a simple point. Really what functional foods are food components that provide health benefits beyond basic nutrition. So basic nutrition, you get your calories from fat and carbohydrates and protein, your essential amino acids, and some of the essential micronutrients like vitamin C. That is your nutrition, the things that are required to keep you alive. But what we're finding is there's actually components within food that not only maintain life, so to speak, but can optimize health. And a lot of work is ongoing in this particular area where we may not, again, necessarily need that particular component to stay alive. But if you want optimal health, particularly at the end of your life, these are the types of ingredients that you should be incorporating into your diet. So why is there an interest in functional foods? First and foremost, we have an aging population. And this is not only a demographic shift that we see in the United States, but this is something we see globally. The population on this planet is getting older. Well, this population that is getting older wants to live longer, but they also want to maintain their quality. We all spend a lot of time and energy saving for retirement, but we don't want to spend that money on a nursing home. We want to spend that money working or playing with our grandchildren, going out skiing, hunting, whatever you like to do. So again, people are very interested in any kind of product or technology that they can incorporate into their diet, into their lifestyle, to help them maintain that quality of life into their 70s, 80s, 90s, and even 100 years old. The other reason for a big interest in maintaining health is healthcare costs. And what are the issues that we have here? We all know healthcare costs are going up incredibly. When I first started at Abbott 26 years ago, you got your healthcare card, you went to the doctor. For the most part, you thought that healthcare was free. You never really gave it any thought. Well, that's changing. One, cost is going up, but also the burden of that cost is shifting. Everyone in this room now, when they go to the doctor, you're realizing more and more and more of those personal costs. And it's no longer going to be an insurance company that's going to be covering those. People are going to be held responsible for their poor choices, and they're going to be held accountable for making those payments into the healthcare system. So again, anything that we can do to provide the nutrition or the foods or the technologies or the tools for people to help maintain a quality of life and health so they don't have to incur those health care costs is going to be a win for everyone. Also, advances in science and technology. I'm not sure if everyone in the room is aware, but Abbott Nutrition has a partnership with the University of Illinois. And that partnership is called the Center for Nutrition, Learning, and Memory, where to date we've invested about $40 million into looking for nutritional components and nutritional products that improve cognitive performance, not only in the preterm infant and the healthy, but also in the elderly. And we have made substantial amounts of progress with our partner looking at certain technologies that will improve cognitive performance in a multitude of patient populations. By partnering with places like the University of Illinois, not only can we identify the technologies that will help improve the quality of life for many individuals, but it's also allowed us to develop the technology to actually measure that performance. And that has been some of the issues that we've had when we deal with foods. Foods, for the most part, tend to be a chronic effect. It takes place over the long haul. So when you go out and try to do clinical studies, it makes it very difficult to pick up those differences because we're not going in with a pharmaceutical intervention. We're not going in with a hammer. We're going in with food. In some cases, it may take 20 or 30 years to see that improvement in disease outcome. However, based on some of the technologies that are available now, we can start measuring early stage improvements that we can communicate to the patient, but also to the doctor in order to explain why one should be using these interventions. Also, why would we be interested in functional foods? From an industry standpoint, there's money in it. There's going to be a lot of money in it. And the one point I want to make with this is the fact that it is food, there's only going to be so much consumption. There's only a certain amount of share of stomach. So if you're not on this bandwagon, you run the risk of having someone come in with a high-tech food, a small player, modest-sized player, where people will shift from purchasing your nutritional product to purchasing a functional food. Because again, there's only so much share of the stomach. So again, people are wanting more out of their food, so this is an ideal place, in my opinion, for investment in certain types of technology, especially from an agricultural standpoint. Okay, what are some examples of functional foods? I just put a shotgun approach here. I think everyone is fairly familiar with some of the technologies that are out there. We all hear that we're supposed to be consuming our fish. That is the polyunsaturated fatty acids like EPA and DHA. DHA, absolutely important for brain development. EPA for lowering triglycerides. We have green tea, we have blueberries, we have catechins, carotenoids. A tremendous amount of work is being done now to identify these technologies and also demonstrating that these technologies offer a significant benefit in the health and well-being of our patient populations. So what are some considerations that we need to make when we invest in functional foods? First and foremost, cost. And this is something that we at Abbott wrestle with all the time. Some of our biggest products are Similac and Ensure. Ensure is a product for the elderly and for hospitalized patients. And at the end of the day, no matter how good that product is, no one is going to spend $50 for a bottle of Ensure. So we do have to constantly consider costs in this arena. So we're always looking for ways to either identify and find the technology from a traditional agricultural base, or come up with that technology once it's identified in the agricultural base, a traditional base, coming up with ways to make that technology so we can cost effectively add it to our formulations. Another area of work that is going to require a significant amount of investment is going to be sensory. At the end of the day, this is food, and people will not give up on the quality and the sensory attributes of that product. They want to be able to enjoy what they are eating. Case in point, fish oils. Fish oils, again, very bioactive, but you put 2 or 3 grams of fish oil into a bread or a cookie or whatever, and people are going to notice it and they're not going to consume it. So a lot of work needs to be done in the area. Efficacy also very important. How much do we have to add to the product? We also want to look for a product where, in one of 2 things. One is the patient notices that when they consume the product they feel better, or there is a device or a technology available that when the doctor recommends that a patient use it, they can measure the outcome. Evidence and burden of proof. This is where we're going to have a lot of debate in the future. There is absolutely no way that we're going to spend the money and can afford to spend money doing pharmaceutical type trials to prove the benefit of a food substance. So we're going to have to change that paradigm. It's going to have to be more related to the preponderance of the evidence, in vitro, animal, small clinical trials. Again, the preponderance of the evidence that this is working for the people that are interested in using the product, and not take this pharma model where you're spending hundreds of millions of dollars to try to get something into the marketplace. And then lastly, regulatory environment. Right now, if you treat or prevent a disease, you're going to be labeled as a drug, and you're going to fall in that regulatory category. My personal opinion is that needs to change. If we have foods and we have food ingredients that actually offer these benefits from a treatment or prevention standpoint, we should have the opportunity to communicate that to the customer, the consumer, and the physician so we can do something about the healthcare situation we find ourselves in. Thank you.